This is Wellness by Design, and I'm your host, Andrew Whitfield Cook. Today we're joined by Natasha Sidoti, a naturopath who believes that we should listen more intently to our patients and the language they use, or else we fall into the trap of treating their symptoms. Welcome to Wellness by Design's Natasha. How are you going?
Thank you, Andrew. Thank you so much for having me on your wonderful education platform.
It is our pleasure. Now, I've first got to ask, what exactly are we talking about here? Because we often dialogue with patients. So how attuned do we have to be?
As attuned as possible. And it's very easy to feel like that doesn't matter in an ever-growing world of functional testing. I was talking to you earlier about how we can often feel pulled in two directions as integrative practitioners. The modern day naturopath, nutritionist, and integrative health practitioner can feel obliged to really understand all the functional testing that's now available, and that's only exploding. Those options are ever evolving. You can feel an overwhelm of where to focus there. And yet we've also decided to study in this field because we know that there's more to it than just compartmentalizing symptoms. So now we need to intersect both in an unprecedented way that's got all this micro detail, and then zoom out again to the macro and see the whole person and do it all at once in your hour consultation.
That's no small skill, because you're scrambling in your brain thinking, what's the real issue with this patient symptomatologically, but you're looking for other things behind.
Behind is the word, and I really appreciate you using that word. It's what's beneath, what's behind, and often the pattern of languaging and phrasing things from a client, even before you have your stool test or your blood test or your organic acids test back, you will start to get some very big clues on the language patterns. And it can be very valuable to reflect them back to the client and see if they've observed that there are themes to the way that they're expressing themselves.
Okay, so this is active listening. This is, paraphrasing and things like that, correct?
Yes, it's more than active listening in the sense that you're also looking for incongruencies in body language. Sometimes there's the unsaid that you can pick up on. You may be physically feeling a response to something the client's saying, but their words are incongruent with the feeling you have in your body. And it's to also trust this process as you're doing your case taking, over and above looking at the blood test, over and above looking at, in my case, the gut microbiome qPCR test. It's been particularly insightful for gut health with clients, as there are so many parallels from the micro to the macro on the markers we can see in a gut microbiome test and some of the language patterns we hear from our clients.
Okay, so that's really interesting. Like, I would have thought about being attuned to somebody's, self-esteem, for instance, or their feelings of apprehension, whether hunched shoulders, reserved, crossed arms, body language, that sort of thing. But you're now correlating things with gut symptoms. Before I continue, I just wanted to ask, to make a point. qPCR is quick polymer chain reaction. So it's a fast PCR test, yeah? Quantitative.
Quantitative, yes. Yes, so the main difference between PCR and qPCR is the quantification of what's detected. And so what I like about qPCR is you get a broader, highly sensitive snapshot. Now, because it's sensitive, if it's not looked at in context, we do run the risk of over-treating the markers that come through. So that's why patterns, once again, we've got language patterns from the client, but also gut microbiota patterns need to be looked at as a bird's eye perspective to see how things are in proportion to one another before we dive in with our gut protocols, so to speak.
Can we delve further into what language patterns are then?
Absolutely. I actually decided to write down some examples because I just found this unfolding over the last few years of clinical practice. So something very simple that helps me is when my patients are talking to me, if I hear a poignant phrase, I write it down. And I often write down repeated phrases that can come up through the session and reflect them back to the client. It sounds simple, but it's amazing how the penny can drop when someone lays the cards out in front of you. One particularly really interesting case was a patient with dysquesia. I never know how to pronounce it properly. It's the over 20 years of a persistent bad taste in her mouth.
Right.
Now, she had also seen integrative practitioners over the years and done some very good classical gut work around candida, antifungal, SIBO diets. She had done a lot of great groundwork and did experience some symptom relief. I noticed the way she was sitting was very contained. And when I asked her about her voice and how often she uses it, the response was quite poignant. It was, I keep to myself, I shut down, my body is used to holding on. And since she was a child, she had observed her mother, who was very all about group harmony, never about any sort of potentially disruptive opinion or feedback. So even if it's something as simple as your opinion on a book or a movie, you may bite your tongue.
Right.
So as we were talking about this, I could see her body soften and this wave completely wash over her, realizing, okay, there's this bad taste in my mouth and I virtually never express how I feel.
So that would have opened up like a whole conundrum of psychological or psychosocial issues rather than the physical issues. Do you find, therefore, that much of your time is taken up counselling the patient?
Yes, and I think that's okay because we are trained in counselling. I think it's okay to a certain point, and everybody has their own level of comfort with that. This was very much a logical process as well around using your voice and expressing things versus suppressing or repressing them. And we had some very small micro goals to work on around mini moments during her week when she could speak when she normally wouldn't. Nothing big and grandiose, no Joan of Arc moments. It was simple, like ordering something on the menu that she really wanted, not what her partner really wanted. Really basic. Right. Over and above that, we continued the gut work. She had a beautiful tonic with some poke root in there as well that I absolutely love using for lymphatic and poor taste in the mouth symptoms. And within 4 weeks, it was gone. That terrible persistent bad taste of over 20 years was gone. So I really value both the gut work and the naming of certain language pattern themes that she was completely unaware of using.
Can I ask, though, when we're talking about, and forgive me for harping on this patient, but when you're taking the patient picture, you've got to take into account all of the potential causes of a bad taste. Or I'm assuming when you say bad taste, would that include metallic taste as well, or a garlicky taste, or what?
Yes.
Right. So,
correct.
So you've then got
and a lot of that was done.
Oh, previously.
Yes. Right. And so it's so important. I absolutely agree with you that there's a duty of care there to explore heavy metals, zinc, even B12, and GI mapping, which we did do. We did do the gut microbiome mapping, and we did find classic species that are overgrown and intestinal bacterial overgrowth. I just call it EBO versus SIBO. So that was all there. However, that final shift, that final nudge really was achieved through understanding psychopathology.
Oh, that's a really strong word. So I've got to ask, though, correlation doesn't necessarily mean causation. Is there any evidence to link to show that this changing a belief system, if you like, or an approach can change actual physical symptoms, can change disease presentation?
It's a great question. I was reading some papers even just this morning. There's a really good new one from just this year, 2021, and it was from Research Square on patients with very high anxiety. There were 21 patients. They had high streptococci, high rhombosia, and low Faecalibacterium prausnitzii, as well as 29 controls, and they all received mindfulness coaching. So this was really fascinating, and there were fantastic improvements to their gut microbiota diversity after mindfulness and meditation interventions. So I'm not necessarily saying when you change belief systems that there's a research paper on belief system change and gut microbiota markers. However, we can see plenty of research out there on interventions that have nothing to do with supplements, have nothing to do with dietary changes, and they will still positively impact your gut microbiota. So why not value all of them with similar weighting? The recent Monash University study by Dr. Simone Peters, who is well known for her FODMAPs research, has come out with a lovely randomized control trial. They admit that the sample size is smaller, so 24 patients in each of the 3 groups. Mm-hmm. One was purely receiving gut hypnotherapy, so no nutritional or supplemental intervention. One group was on FODMAPs, and the second group was on a combination of the two. They all reported equal improvement: 71%, 72%, 71%.
Wow, that's incredible. Okay. So I've got to ask here: are we talking really about here the gut-brain superhighway? You know, that neurotransmitters. You know, we know that depending on the textbook or the expert that you listen to, anywhere between 90 and 95% of the body's serotonin is made in the gut. But you've also got other receptors for other neurotransmitters as well. Are we therefore talking about modification of the bacterial milieu and therefore potentially symptom presentation because of the gut-brain highway and how we are training, I'm going to say training our brains to train our gut? Does that work?
Yeah, and it can be the chicken or the egg, because a poor diversity in the gut microbiota will negatively impact our nervous system state and our mind, and vice versa. So there is no clear research paper that say this is actually where it starts, and then when you change this, this is how you influence it. You can circuit break where you like, but what I'd love to encourage all of my colleagues to do is to circuit break it from both angles, with confidence that you are treating the whole person. There was another research paper on secretory IgA, which is a great marker for gut protection to the enterocytes. So it's that beautiful mucousy layer that protects our intestinal enterocytes. And when that's low, we are much more at risk of increased permeability or leaky gut. So often as that drops, zonulin can start to creep up. As zonulin starts to creep up, antigliadin IgA can also start to increase. There's a bit of a triad between those 3 markers. There are mice studies to show that non-digestive stress will lower secretory IgA.
Do you know what? Like, I think I'm waking up. I'm picturing things here, like, for instance, the work that was done, forgive me, I can't just place her name at the moment, University of Tasmania researcher, she's brilliant. But she did some work on elite athletes and I think it was emergency, first-line responders, firemen, things like that, under extreme stress. And then there was some further work done on intestinal permeability with footballers, elite athlete footballers. And so we're talking about a physical or repeated physical stress or on their bodies. Then you've got emotional interplay, and you've got symptoms of, let's say, intestinal permeability. The danger is to just give a supplement of a probiotic. and think that that's going to heal them.
Mm. Yes, and you will provide symptomatic relief, and it can feel a bit more like green allopathy, and there's nothing wrong with that. It's just important to reconnect with why we studied what we studied in the first place. So that makes a lot of sense to me, what you're describing. So we're picking up on themes that as stress increases or as chronic stress persists, and it can be very high functioning, that chronic stress, as that persists, diversity of the gut microbiota is reduced. Some of those species, like Faecalibacterium prausnitzi, that are so important as a short-chain fatty acid producer, are compromised and reduced. Secretory IgA is low, permeability is high, and then we have increased interface with the immune system just on the other side and woven through those enterocytes.
So now, like going back to the psychology of it, we know, for instance, that post cabbage or stent insertion, that it's very common for sufferers of cardiovascular disease or heart events, cardiovascular events, can suffer depression. So now we've got this whole gut body interplay. It's, I'm thinking about SIBO, about IBS, rheumatoid arthritis here. So you're bringing out this whole game of, it's further than counseling. What you're talking about is these language patterns, which is really interesting to me. So do we see objective changes with the microbiota milieu and symptomatology with purely psychological intervention or active listening?
Yes, you will see, if you look up gut hypnotherapy and IBS, you'll see a range of papers. There's one from 2003 with a sample size of 204 clients, and it's a prospective 6-year study. I've got the links and I'll share it with you. That one is fantastic, and clinically significant benefits to the IBS symptom feedback from the client. We also know as integrative practitioners, some of us interchange the term now IBS with SIBO. They are, for some, becoming synonymous as terms. Yeah. So yes, there absolutely is. It's a growing area of research, and it's actually not saying this is better than, but it's saying it's equal to. So I think where we could strengthen the gut work that we are doing with diets to reduce, FODMAP or SIBO diets and gut protocols when we do get results. What can often happen is 6 to 9 months later, the patient will feel a relapse because we really haven't looked at the whole picture behind the food, behind the lifestyle. What else is happening? And perhaps we'll get better long-term benefits for our clients if we also emphasize, okay, what is it about yourself and your patterns in your life that has led to this symptom picture as well?
Well, you mentioned that 6-year prospective study. What happened there again? What was the results over 6 years?
So over 6 years, there was some mild deterioration in symptoms, up to 18% deterioration from 3 different really heavy questionnaires as feedback. So there was quite a sustained improvement, but I'd say it's like your physical fitness. If you stop going to the gym, eventually it will drop off. And the same would be for mindfulness. Use it or lose it. And eventually I suspect the microbiota changes would resume, and you could retreat again and pulse treatment, and that's valid. Or you could do both and see how far that takes you.
You've then also got to be obviously quite aware of how people return to a safe environment. And if that safe environment is, as you spoke about that first lady, not talking, not giving her opinion, then her symptoms will obviously regress to that point. So how much work, you're talking about really like in-depth ongoing work here, right?
Yeah. And that's okay. And it may be 6 weekly check-ins to see how your patient's tracking. As far as them feeling safe, there are some good tips that we have learned when we did do counselling around also reflecting back where the patient is comfortable discussing certain things. And once again, setting micro goals, they don't have to be so grandiose. I myself am hit and miss when it comes to habit change and defaulting to certain nervous system patterns. So it's an active practice. Well-being is a verb, not a noun. And truly looking after your gut microbiota goes beyond taking digestive enzymes, goes beyond having magnesium AM and PM. And if that is all we lean on, we are missing the whole picture.
Do you find that, a couple of things, do you find that sometimes you reflect back the language patterns and you'll find them cringe? You'll find them go, uh-oh, I've been exposed?
Yes. Yeah, there is a sense of vulnerability there. If we're comfortable asking questions, our clients will eventually be comfortable too. So I just want to encourage colleagues to say it's okay to ask questions. It's okay to listen. We don't have to fix anything. Simply reflect back what we're hearing. Do you know, today it was the strangest thing, Andrew. I spoke to my dad just before this podcast. He had no idea I was doing it. And I had no idea that for over 20 years he was relying on herbal laxatives. No idea. And so he's trying to come off these herbal laxatives, and he's concerned that he basically won't be able to. So he's been on some drop dose ginger and digestive enzymes to try and support motility. And he reflected back on when he was a child, when this first really kicked in. And he was in Prague with his mother and his sisters. Now, my grandmother, who's now passed, was an Auschwitz survivor and very much in survival mode. So you can imagine there's actually research on trauma victims and persistently raised cortisol levels, also in their children. So you can imagine her blueprint nervous system state. So they went on their usual Sunday walk, and Dad had diarrhea and he couldn't control it. He was 10 years old. He was trying so hard to hold on. He couldn't. By the time they were just in front of their apartment, he lost control of his bowels and his pants were ruined, his only good pair of pants. And he said, in his words, he said, and Mum kicked the shit out of me. So from that age, he's been holding on. And yes, he probably also has SIBO now, and that's real. But it also can be quite revolutionary when you go, okay, so the nervous system can really drive your gut microbiota patterns and markers.
Okay, so let's sort of talk about that case for a while. Like, this is ingrained from childhood. How then, when they visit you, like you've only just found out now, so we're talking some, I'm going to guess, minimum 35, possibly 40 years.
Yep.
And we're going to try and change that patient, their health ongoingly. That's a tough job.
That is so tough. So I certainly don't expect that I do that alone. Naming it is amazing and can be quite a release. Like I mentioned, for that patient with the persistent bad taste in her mouth, simply naming that she wasn't using her voice seemed to really shift that metallic taste over and above the herbs and the supplements.
Oh, okay.
He's named it now. So that's a really good start. And then it comes to referring to people that you feel are really helpful and supportive of the embodiment of how you're feeling. So it's no longer an intellectual process, because a lot of us have pretty good intellectual understanding of where we're at and why. It doesn't mean we actually change anything. So any embodiment practice could be very useful. For some, it's emotional freedom technique. For others, it's movement like yoga, qigong, or meditation after quite vigorous exercise can be quite helpful for some people who find it very challenging to just drop into meditation. You may have also heard that there is a new app designed by Monash University on gut hypnotherapy. Now, whilst that doesn't necessarily address your specific story, it is very helpful for rewiring circuits, brain circuits, and beliefs around your digestive symptoms. And this is the program that is equal in efficacy, according to the recent paper by Dr. Simone Peters, to the FODMAPs diet. So using things like this app and trialing them with clients, I did compare it to some other mindfulness apps. I wasn't convinced, is this any different to just straightforward meditation? But it really is, because it drops you right in to very gut-specific hypnotherapy, and very safely. So you did mention the term safe. So the practitioner, to the point of their comfort level and their skill level, can also bring in these resources to support embodying new responses to the perception of digestive stress, which we know will also reduce that visceral hypersensitivity that is so classic in SIBO and IBS patients.
And have you seen changes yourself, objective changes, when you're doing the qPCR? Have you seen changes in the milieu? You're probably going to be talking about holistic therapy, so including supplements as well, but have you seen that, let's say, hold if you've done the hypnotherapy rather than without?
Yes, I've seen a longer lasting impact when we do both. So I've seen a reduction in relapse, and that's what's really helpful from symptom feedback from the clients. So you also see microbial markers, particularly I love looking at secretory IgA. That's a really important one to me. And the distribution of species. I'm not particularly concerned by the opportunistic species that we are observing, but their proportionality improves. And then we know the assimilation of nutrients has improved for the client. So I also see an improvement in markers like iron and B12 in the blood tests.
Whoa, okay. Now, I've got to catch myself there. I said hypnotherapy. Is that a correct term?
Well, that's the correct term for the Monash-designed app called Nerva, Nerva. There is a free trial, so you can do 7 days. Be warned, if you don't uncheck the box, it'll be $100 charged. So just be aware that you've got 7 days. And it's a really great way. I encourage practitioners to just listen, and you will hear quite a difference in the structure between straightforward mindfulness practice and this gut-specific hypnotherapy. And I find that this sort of research is really affirming what we have been doing as clinicians for a very long time around truly listening to our clients to hear what else is happening on an emotional level for the patient when they're bloated, when there's that bad taste in their mouth, when they're holding on, when they're anxious and they feel so filled up and constipated. And yeah, they have confirmed overgrowths as well that completely fit into that picture. There was another client last week who basically said, my body is used to holding on. A lot of people are relying on me. I can't hear myself. I don't even know where my voice is. I don't know who I am, and I don't feel focused. How on earth are you supposed to have healthy digestion if that's your day-to-day normal?
I got to say, like, no offense, but the fact that Monash University is doing this speaks volumes, because they're a pretty hardcore orthodox, let's say, university, not usually entertaining of, let's say, fringe treatments. So this is, that in itself speaks volumes. But
yeah, I completely agree with you.
But I'm so impressed that you've already been doing this. So what is it about you that you've always been this listener?
Language has always fascinated me, Andrew. And I feel like it's so much free information during the consult. So we don't always need to wait till we treat the client before we get test results. And what I mean when I say treat, it could be some really simple interventions, but start to trust your observations more. You may have observed there's even a difference in the clinical examination from a new GP compared to the classical old school GP, where they have more reliance on that clinical case taking an observation that's right in front of them. It's the same thing that we need to remember amidst all this functional testing. I was raised by a mother who was a trauma psychotherapist, so I think that's helped as far as being comfortable with the uncomfortable. She also had a background in theatre as well, so a lot of expression has been encouraged. And of course, I've given a snippet into my father's history, where there's a lot of family trauma through the Holocaust and World War II. So I have an appreciation for the importance of your background and how it impacts your biochemistry, your physiological markers that you will see in a test.
We say this so often about how, the biochemistry affects the psychology. We're now looking at probiotics for depression or sadness, depending on how they're gauging it, whatever, anxiety. But we've got to be very careful not to forget the importance of listening. I've got to ask you one more question, and that is to invest a lot of one's energy in active listening and taking on what can sometimes be quite traumatic case histories. You've got to be able to care for yourself. So how do you teach, or what do you say to your peers about taking care of themselves while taking care of others?
So important. And you've been in this industry for a while now, Andrew, so I'm sure you know people who use the term burnout and just say, I've just got nothing left.
Yeah.
You're nodding your head fervently. So it's really common. A lot of us are very compassionate, and we can run the risk of, in your words, taking something on, which is absolutely not healthy and can somatize in the body. This week, I stuffed up. I let down a few boundaries with clients, and I knew immediately that it was a problem for my health. So you get better, like your clients are becoming more attuned to their mind-body feedback. You become better at it too. And sometimes it can feel like 2 steps forward, 1 step back. For me, it's really important to have physical interventions, not just intellectual processes. So I love swimming in the ocean all year round. I don't swim very far, but I just love that feeling.
Yes.
Yoga for me is very, very helpful, and I do that every morning before the kids wake up. And also any sort of embodiment technique, like I mentioned before, emotional freedom technique, can be very helpful. And reminding ourselves that the best thing we can do for our clients, listening to them versus taking on literally what they're experiencing. So you may find sometimes after a case taking or seeing a client that maybe within a few hours, lifetime, or a day later, you may start to feel some of those physical symptoms that they've described. That can be feedback that you need to improve your boundaries with your clients so that you can practice for longer and sustain a healthy life yourself. And trust me, I've stuffed up left, right, and center with that, and I'm getting better. Well, I've got a long way to go.
But isn't that part of the whole journey of being a successful practitioner, is forgiving yourself? Because we will stuff up. There will be times where we don't succeed. So to allow yourself mistakes, to be human, is actually part of that journey.
Absolutely.
The lessons we learn.
And and for me, it goes beyond logistic boundaries. So logistic boundaries are really helpful, like don't answer emails after X and good amount of space that you need for your treatment plans in between consults. That's all really fantastic. However, if we do start to listen to language patterns and reflect things back to the clients, we can sometimes feel tired after a consult. So it's also about some of those other interventions I mentioned to you that go well beyond just logistic boundaries in your clinical practice.
I've just got one last quick question, and that is, do you find that you spoke about the physicality, swimming in the ocean and things like that, which I totally agree with you, despite the numb feet in winter. But anyway, do you find that after a heavy session, you find yourself having to shake, ring, get the limbs moving, even a stretching exercise, something like that in between patients, that shaking off of the concerns of the last patient can be a message, if you like, or a boon to you?
Yeah, I think that's a fantastic suggestion. I haven't actually tried the jiggle or the shake, but I agree, because it would also stimulate your lymphatic system, your circuit breaking something. And as we know, ritual and habit on repeat creates momentum. And rewires certain circuits in the brain, whether it's a good habit, a helpful one or an unhelpful one, or an adaptive one or a maladaptive one. Anything on repeat will cement certain circuits and biochemistry behaviors of the body. So I'm going to try a little shake it out. I used to do belly dancing, so I've got some ideas already.
I could do belly dancing, but I'd break screens. Yeah.
Absolutely. And, you know, after watching my octopus teacher, how long he's in the water for, those cold waters in that kelp forest, has been truly humbling after my little mermaid dips. So I'm sure we can all have some version of nature immersion where possible, wherever you're based, even if it's just the weekends and not possible for you during the week. Gosh, it's so valuable.
Yes, even if we're talking about electron transfer. I can't thank you enough. Like, there's a real awakening about, I guess it's, we hear things, we learn things about active listening and verbal and non-verbal cues. We hear them time and time again, but to actually see somebody who is a specialist in that is really quite remarkable. And I've got to thank you on a personal level for looking after a friend of mine. And it truly shows your true expertise in listening to not just the verbal and non-verbal cues, but the whole story opening towards you, and how you can change somebody's trajectory on quite a serious disease. It's very impressive to me. I can't thank you enough how you truly look to heal your patients, not just relieve their symptoms. And I thank you warmly for joining us on Wellness by Designs today, Natasha.
That means so much to me, Andrew. That was a beautiful moment for me, and I thank you so much. We all try to treat the whole person, and if we just have more faith in what we're hearing and seeing right in front of us, that combined with the functional testing will really help shift long-lasting results for our patients.
Brilliantly said. Thank you so much also for your company today. And of course, you can find all the show notes and the other podcasts on the designsforhealth.com.au website. So I'm Andrew Whitfield Cook, and this is Wellness by Designs.